Hello, I am Dr. Ashwini. I am a fetal medicine specialist and I work at Cloudnine Hospitals, Kanakapura Road. After perform this combined test, that is the 3rd month scan, the NT&B scan and the double marker test, a final risk is given for Down syndrome. And this risk can be categorized into either high risk and low risk depending on its value. If the risk is higher than 1 in 250, it is considered high risk. That means if there are 250 pregnant women with similar findings, there is one fetus that can have Down syndrome. This is a screening test and not a diagnostic test. That means we really don't know which of these fetuses have Down syndrome, and a further confirmatory test needs to be performed to diagnose which of the babies have Down syndrome.